Democrat, California, Representative Sam Liccardo. Indiana, Republican, Representative Marlin Stutzman. Gentlemen, first of all, thank you for doing the hard part. Thank you for coming on together. I appreciate you both very much for doing that and showing the audience we don't all have to act like savages all the time. Would either of you like to say, no, I have it wrong, the costs come from something else? It's not about what I just laid out, that it's not about a cost structure from a business that has just dominated our process.
Well, I'm not going to take any issue with that fundamental fact.
We agree.
Go ahead, Marlon. I'm sorry.
Go ahead, Sam.
So we
Go
agree.
ahead, Sam. No,
we'll make this is easy. We all agree. Good. Let's go to what can be done, because neither plan that was put up today. Yeah, neither plan put up today in the Senate, not you guys, but subsidies, we obviously need them, but we need them for the wrong reason, okay? You want to give me a health savings account? Great, but that doesn't change how much I have to pay for things. So, you know, I'll start with you. Sam, you tell me, what's better than what we got right now?
Well, I put together a bipartisan bill, the Fix-It Act, that would focus on going after some of those cost drivers. Insurance companies, for example, on Medicare Advantage, that are driving up enormous costs from taxpayers through what's called upcoding. So we need to reform that process in which those insurers get compensated by the government, and going after some of the insurance brokers who are making a lot of money fraudulently signing folks up without their knowledge. With those measures, we're actually able to more than pay for the extensions of the ACA tax credits over the period, and that's why 6 Republicans joined me with 5 other Democrats on the bill. The problem, of course, is that bill's not going to get to the floor.
Marlin, what do you think about the idea of Medicare for all? What bothers you about it?
Well, you know, Chris, I would say that that really takes out the free market aspect of healthcare. There needs to be some sort of competition in the marketplace. I mean, let's look at, you mentioned, you know, if you go to the emergency room, and of course you're not going to be asking, what is my price going to be when your son or your daughter has a broken foot? You want to get treated. Well, the problem is then you get the price a couple of weeks later, and that's when you get the sticker shock. If you did the same thing with an automobile, and you took the automobile home, and then they sent you what you were supposed to pay for the car, and it's way more than what you ever would have expected to be, you're going to take the car back. But you can't do that with our healthcare system. I think what's the problem is, Chris, is that there's too many hands in the cookie jar. I don't disagree with you one bit, other than I do think that health savings accounts is a short-term fix. It's part of the answer. I guess I just don't have any sympathy for the insurance industry, because their profit since Obamacare passed is 400%, over 400%. The insurance companies are making a boatload of money off of the taxpayer, as you mentioned, through subsidies, and then they're hiring the doctors out of the industry to come over and work at health insurance companies to set the prices, and they're negotiating back and forth. So the overhead of healthcare is way out of control. There's simple systems that we could put in place, I believe. It's not an easy fix overnight. That's why it's going to take us some time. And there is a political liability, because if it doesn't go well, as we saw the Democrats, you know, had to deal with that back in 2010. It is a very complicated issue right now, but we need to simplify it.
Well, you need to simplify it, but I mean, even in the explanation of it, it gets very tricky very fast. You know, you say you want more competition, but everybody's pricing it to the locality. So you can put money in an account for me and let me go shopping. Instead of in New York, I'm going to get it from an insurer in Ohio, but guess where they're going to price my policy from? My catchment area, wherever, that's where it's getting priced from. And they don't want your sympathy, right, Marlon? They want your fealty. And if you don't do what they say, they're going to run somebody against you and fill up their coffers with PAC money, and you're going to have your hands full when they start threatening jobs in your district. They have it a lot of different ways. Now, you know, I can look at the data, Sam, and the ACA worked out well for Democrats. It got more people access to health care. It was never supposed to be, it should have been called the Accessible Care Act, not the Affordable Care Act, because it was about expanding it, and the hope was that states would pick up on the Medicaid waivers, and they didn't. So, you know, the red states didn't want it to be what it could have been. But we still have the cost structure problem. The beauty of Medicare for All from Bernie and others is the government will tell the corporations what they can charge. Are you in favor of that?
Well, if somebody can figure out a way to pay for it, I'll find a way to support it. But fundamentally, we have a system now, far from perfect, as you have clearly pointed out. But we all know that healthcare costs were skyrocketing before we had the Affordable Care Act. That's exactly why the Affordable Care Act was put into place. This is not a new problem. Yes, there's a lot of interest groups that make a lot of money off the complexity and the disaster that is our healthcare system. There's no question about that. But to attribute it to the Affordable Care Act, I think, is wrong. I think Affordable Care Act has enabled us to dramatically reduce the number of uninsured in this country by nearly 20 million people.
True.
And that is critical, particularly with the subsidies that help folks who struggle with everyday costs.
Here's my last question for you guys. And again, I'm not putting you on the spot. I love having you on. You're always welcome here. How are you going to test this when on your side you got the Speaker of the House got $1 million? You got Hakeem Jeffries, he got $1 million. Thune, he got $1 million. Schumer, he got $1 million. You know they're not going against the guys who gave him the money. I mean, you know, when does that ever happen? I mean, you can't say, well, everybody gets the money, so we're all on an equal playing field. I mean, Marlin, do you know anybody who's got more juice in terms of leverage with government than these healthcare companies?
No, I don't. I mean, you know, it's a very powerful lobby. It's a very powerful industry. And partially because there's confusion, you know, especially with the consumer. The consumer is the one holding the bill at the end of the day. And as you talked about medical debt earlier, it's because people can't plan for a visit to the hospital, and all of a sudden you got to do a bypass surgery, and then you get the bill for that. And you know what? There's going to be cases like that where we have to set aside, you know, that sort of operation to be able to be paid for, because it's an exorbitant amount. It does cost, but at the same time, a lot of our routine visits to a physician, those should be very simple. Let's try to, you know, the liability that also comes with healthcare is exorbitant as well. So again, I think there's too many hands in the cookie jar. As I said earlier, people see it's a place to make profits because there are a lot of government dollars that go into healthcare, and they're going after those dollars because they see it's an easy place to profit. The bottom line is obviously.
Go ahead.
Well, I was just going to say that there's too much focus on the bottom line rather than focusing on the cost. And I think that we have to drive costs down through competition. I've got a hospital system in Fort Wayne that they're one of the highest cost providers in the country. This is Fort Wayne, Indiana. We're not a high-cost state. Well, we've got a hospital that's going to come in and compete with them, and that's what they need.
Good. Look, that's great. You can have competition, but it comes down to who gets to set the cost structure. And that's the beauty of Medicare for All, right? Is the sell proposition on that is the government says this is what you can charge. Had been working better for Medicare, but now that's starting to change also. Gentlemen, I appreciate your candor.
And Chris,
we'll keep talking about this. Go ahead, Sam. I'll give you a last word. Go ahead.
Yeah, just if we're going to talk about competition, let's be clear. Over the last quarter century now, we've seen more than 2,000 hospitals in mergers. We're getting less supply, not more supply. That is fundamentally a core issue.
Yeah, because they're consolidating. Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.